The blood supply of the femoral head is quite unique with respect to the anastomosis and the variations. So femoral head is supplied by a medial circumflex femoral artery, lateral circumflex femoral artery, obturator artery, and the metaphyseal vessels. The medial circumflex femoral artery and the lateral circumflex femoral artery makes an extra articular arterial ring, which gives a one major branch with a lateral epiphyseal artery, which extends and goes intra-articular and makes an intravascular arterial ring. The major blood supply is from the medial circumflex femoral artery, which is at posterior to the neck. The obturator artery is present in birth and which would reduce its supply till the age of 4. The metaphyseal vessels are supplying the femoral head itself. Due to the epiphysis in the beginning, the blood supply is not developed, and the physis is a barrier, which later on resorb, and at the growth when the plates are fused, then there's a metaphyseal blood supply as well. So if age related, talking about the age related, at the beginning, the major blood supply is almost equal with the medial and lateral epiphyseal, lateral and medial circumflex artery, as well as the ligament teres as a blood supply for the femoral head. Later on, the ligament teres blood supply is obliterated, and the major blood supply is a medial circumflex femoral artery. This change happens till the age of 4 to 5. Therefore, we see if there is some aberrant from anatomy, then we see Paeds disease at the age of 5 to 7 years of age.